The Department of Health estimates that unused medicines cost the NHS around £300 million every single year, with an estimated £110 million worth of medicine returned to pharmacies and £90 million worth of unused prescriptions being stored in our homes. New research from the Co-op Health out today reveals that we could be handling our repeat prescriptions better. To discuss this, we're joined by TV medic Dr Ranj and pharmacy superintendent at Co-op Health, Rachel Clark.
Hi, I'm Dr Ranj Singh, and you may know me from This Morning and also Strictly Come Dancing.
Hello, I'm Rachel Clark. I'm the pharmacy superintendent at Co-op Health.
So, Rachel, you've done some research. Can you tell me a little bit about the research?
Of course. So we've been told that lots of people have got huge amounts of leftover medicine in their homes. And it looks like they're either ordering too much, not necessarily because they're ordering it themselves. It may just be that too much is ending up on the prescription. Or perhaps they're not finishing courses. So, for example, things like antibiotics. People tend to be taking a couple of days of them. And then when they start to feel better, they stop. What we're sort of hearing loud and clear is that people are really reluctant to throw these types of medicines away, and mainly because everybody understands now that the NHS is under such pressure from a financial point of view, and I think people really appreciate how precious those NHS resources are.
So you touched upon the cost to the NHS. Is there a cost, both financial cost, but I suppose also a time cost of this?
So the impact on the NHS of unused medication is significant. Firstly, there's the time cost involved in, going to your pharmacist or going to your GP and getting repeat prescriptions, and all the labour that's involved in ordering and issuing repeat prescriptions. And if you don't need those medications, that labour could be saved for someone else. But it does also cost the NHS a huge amount of money. We're talking estimated £300 million a year. Now that can actually pay for over 11,000 community nurses or 20,000 breast cancer treatments. So it's a huge sum of money that we could potentially save.
How and why do you think people are wasting medication?
So I think they're either over-ordering by accident, or perhaps they're finding that there's too much on a prescription. So it might be that pharmacies have in place automatic ordering schemes some of the time. So that might be one of the reasons behind it. Or perhaps that people aren't taking full courses of things. So with antibiotics, taking a couple of days and then sort of feeling better and stopping after that. Obviously, if you've got a course and it's being prescribed for you, you really should be finishing that course, because even though you might be starting to feel a little bit better, that infection, it won't have been properly treated, and you may find that it comes back and you end up having to revisit the GP for another prescription after that. So we're finding that when people haven't thrown things away and they've got these stockpiles, they're then either further down the line sharing them, perhaps with friends or with family, or even worse, ending up using these medicines when they've gone past their expiry date. And it can be quite dangerous. So using medicines that are out of date, even if they were sort of perfectly suitable for you beforehand, there might not be that same active ingredient left in there, so they might not work, or even worse, you might end up having side effects that you wouldn't previously have had. So certainly if you've got medicines that are out of date or that you can't use because you've got too much of it, please just dispose of it by taking it to a pharmacy.
Now, the research, I believe, has also touched upon the fact that we're sharing our medication with our friends and family. What are the impacts of that, and why are we doing that?
So 27% of us will admit to holding on to prescription medication in case friends and family need it in future. And that's potentially harmful because sharing medication inappropriately can cause significant harm. You should only use medication when it's prescribed for yourself for the instance that it's been prescribed for. So don't reuse it in future, because actually you're not a medical professional necessarily, and what you may think you have may not be the case at all. You may be administering inappropriate treatment or even causing yourself harm. And also, likewise, sharing it with other people. They may not have what you think, and I would say urge them to go and see a health professional and get their own prescription. Don't be sharing your medication around.
What do you think we can do to help? How could we ensure that we only really order what we really need?
So there are lots of types of technology out there that can help you manage medications in terms of when you take them, and also to help you order those medications. So lots of people find it really difficult to get to a GP surgery. It may be that they don't live particularly close by, or perhaps the opening hours just aren't convenient for them, particularly if you're sort of working full time and you've got a very busy schedule. So there are lots of apps out there that will help you place orders for prescription items, and the great thing about them is that you can really order just what you need, exactly when you need it. So you don't need to kind of worry about having to order things in bulk, because it's really inconvenient every time you do it. You can literally at the click of a button just have what you want when you want it.
So where could we go for more information on what we should and shouldn't be doing with our medication, and also on the app that you mentioned?
So the NHS website has got loads of really useful information on there about how to safely dispose of medicines. And in terms of apps that you may find useful, if you visit the Co-op Health website, you can find out about the Co-op Health app on there, and you can download it from either the Apple Store or Google Play.